Insulin resistance could be the silent epidemic that no one's talking about, and it could be aging you faster than you know. It's Dr. Debra Durst, and I specialize in hormones, regenerative medicine, and sexual wellness. And today I want to talk about insulin resistance. So, insulin resistance, what is it? So, there is a range of blood sugars that you have when you get your blood drawn. And when you go to get your blood drawn, I highly recommend that you do that in the fasted state. What that means is that you have nothing to eat or drink except water. So, you can do water and pills, but outside of that, there should be nothing that basically increases your blood sugar because you want a fasted level. And that fasted level is very easy to measure, but also can tell you a lot about your health. Because I think that as we have elevated fasting blood sugars, it is insulin resistance and can lead to lots of different effects. So, if we're talking about a fasted blood sugar and a range, for the most part, they will basically say that less than 100 is normal. Between 100 and 125, that's prediabetes, and then above 125 is diabetes. But if we look at that less than 100 to be normal, that's actually not true. And so anything above 85 as fasting blood sugar will actually put you at increased risk for insulin resistance. And if we're talking about a normal range, you have normal blood sugar regulation, you have no disease, or on the other end of the spectrum, you're diabetic and you have trouble either making insulin or your insulin is very resistant. And in between is insulin resistance. So it's leading down the pathway to the diagnosis of diabetes. So we want to catch it there and just know anywhere along that spectrum, you can improve it. And so it doesn't matter where you are, you want to know where you are. So either getting a comprehensive blood panel by your physician, but doing it fasted. But a lot of people will use continuous blood glucose monitors at home. And those are little devices that can go on the back of the arm, and you can use an app to follow that. A lot of these are now Bluetooth linked. And so when you wake up in the morning, that would be a fasted blood sugar. And you want to know where that is. And so anything above at 85 or below is normal. Obviously, you don't want it too low. But anything above 85 puts you at a slightly increased risk for developing insulin resistance. And so every point above 85, I would almost consider a 1% increased risk of developing insulin resistance. The reason you don't want to develop insulin resistance, again, you have metabolic issues, you gain weight faster, your blood vessels don't function as fast, it sets you up for cardiovascular disease, brain diseases, and bad erection and sexual quality as well. So lots of things can happen, or again, fasted blood sugars with your doctor. But otherwise, I had done other videos, and grossly with men, the risk at certain ranges might be more elevated than this. But with large scale studies, basically it said between 85 and 89. So if you're up to 89 at that fasting blood sugar, you're about 1.5 times the risk of developing insulin resistance. And if you are between 90 and 94, 1.5 to 1.8, so almost 2% or 2 times potentially, 95 to 99, 2 to 3.5. And then obviously above 100, it increases to almost 4 to 8 times the risk of developing insulin resistance. So knowing that fasting blood sugar is super important, and just know 85 is your goal range. And then anything above that puts you at risk. And some of the studies with men showed it even to be higher than the numbers that I just stated. But just know that you want your blood regulation to be solid and to be good so that your brain health, your cardiovascular health, your vascular system leading to sexual function and better erections, arousal and orgasmic strength for women as well. That needs to be the root cause of dysfunction there can be insulin resistance and poor blood sugar regulation. So just know this is an easy way to measure. Get a heads up on that and get ahead of the game. And change some lifestyle habits, and even talk to your physician or a regenerative doctor like myself to get other suggestions for regulating that blood sugar tightly. So hopefully that helps. Let me know if you've had any experience with continued glucose monitoring. I have worn one in the past. I plan to restart that soon. And I love to get feedback and open conversations about that in the comments. And then again, willing to deep dive into anything wellness or sexual wellness. So let me know what else you want to hear about.